Headache and migraine is the most common reason for the visiting doctor for the working age females, and it causes a lot of sick day leaves. Migraine and its background is diverse and unique within person. This is the reason why I wanted to check what studies show about non-pharmacological approach concerning about the migraine. I want to help my patient in own office and provide useful information also for my watchers. Also, I wanted to know, is there some sort of common factors with the person who have migraine and what is needed to know when working with that kind of client. One big factor on the background has revealed itself. Small arteries of the head and brain contract during the symptom provocation. From this information, is there some sort of exercise or exercises or protocols with that what might be useful with the clients with the migraine? Let's stick to this topic from the oldest article from 2008. Researchers did pilot study what combined aerobic exercises and relaxing exercises. Study population was quite small, only 30 female participants. Intervention included 6 weeks exercise 2 times per week. Exercises included 5 minutes warm-up, 15 to 25 minutes of aerobic exercises including coordination stuff, 10 to 20 minutes of strength exercises and 5 minutes of the stretching. In every exercise session at the end they had progressive relaxation for 15 minutes. Also there was control group what had general information about effects on the exercising. What kind of variables were reported? Questionnaires about pain, image of body, depression and quality of life. Outcome from this pilot study was that there was no effect on the frequency of the symptoms between control and exercise group, but exercise group had changes in questionnaires about depression symptoms and they had overall better mood. Luetke et al. Had interesting article in 2017 made in Germany. Researchers wanted to know, is there some sort of pattern of findings with the musculoskeletal testing within groups with the clients with the migraine. In this study, manually orientated physiotherapists tested 138 clients with the migraine and 73 persons without migraine symptoms. Test what was used in this study. Active range of motion in cervical spine, in flexion, extension, lateral bending and rotation. Upper neck movement in rotation, lateral bending and in flexion and extension movement. Passive testing of the cervical joints. Chin to the chest move and then non-painful rotation from upper neck. Palpation points. Sternocleidomastoid, masseter, temporal muscles, suboccipital muscles and trapezius. Trapezius force. Chest spine movement in rotation and also manual testing of the joints. Craniocervical flexion test, what tests the stabilators of the neck in anterior part of the neck. What kind of common factors were found in the population of migraine clients? Persons with the migraine had more findings on the trigger point of the muscle compared to the pain-free population. During the active movement of the chest, there was no clear factors, but in passive testing, the chest and neck joint, there was clear range of motion decrease in the patients with the migraine symptoms. Most restricted area was upper neck area, cervical 1 and cervical 2 segments. 3 different models could explain the higher prevalence of musculoskeletal findings in migraine clients. Frequent migraine headache causes muscle tension in the neck, consequently resulting in joint dysfunction due to, for example, reduced mobility. Pre-existing cervical joint or muscle dysfunctions serve as a trigger for migraine attacks. In highly sensitive system, pressure as applied during the joint palpation or trigger points is more likely to interpret as pain than in non-sensitized system. Also in a group of migraine clients, there was less activity on the neck stabilator muscles compared to the pain-free population. Good takeaway message from this is that people working with the migraine clients always check the passive movement from the chest and from the neck if you want to know where the limitation exists. Nice article came out from Switzerland in 2017. Hansen et al. Had study about aerobic exercises and how does it affect on the various arteries in the eye. In the study, there was 45 clients and they were separated to HIIT, moderate continuous aerobic group and control group. HIIT and MCT group had exercises for 12 weeks, 2 times a week. Before exercising, they had examination for the several eyes, arteries and diameter of the vessels, and similar examination were done after the exercise intervention. High-intensity interval training group had 4 intervals ranging from 90 to 95% from their maximum heart rate, and the intervals lasted 4 minutes. Between the intervals, there were 3 minutes of a lower heart rate exercise when the heart rate came down to about 70% from the maximum. In moderate continuous aerobic group, people maintained about 70% of the heart rate from the maximum. In control group, researchers advised to do mainly the normal everyday activity. In group of HIIT and MCT, frequency of the migraine attack started to go lower. From exercises, aerobic endurance started to increase and the diameter of the vessel started to grow. This research takeaway message is that HIIT type of exercises can have good result reducing the frequency of the migraine attacks in less time compared to regular aerobic exercises. Study population in this was quite small, but hopefully we have some sort of result in a big population in near future. Lemmens et al. 2019 had literature study and meta-analysis from the multiple databases. They wanted to find out is there any evidence about aerobic exercises reducing total amount of the pain and frequency of the migraine attacks within research population. After the study, the conclusion were that there was moderate evidence that aerobic exercises reduces frequency of the migraine attacks in month with training, and only low level of evidence was found about migraine pain, duration and intensity of it from the exercises. Last but not least, there was good article made by Zhong and Zhu from 2021. In the article, they had good structure how to exercise if you are client with the migraine symptoms. They checked the literature all the way to April 2020. Body of the article came from 50 different articles and there was good stuff about how to exercise. Aerobic exercises, example walking and biking, should be done in 60 to 70% of the maximum heart rate. If the client is not able to do exercises in that kind of heart rate areas, then it's supported to drop down the heart rates minus 10% from the used area. Exercising should be done 2 to 5 times per week and exercise duration should be around 40 to 50 minutes. Before exercising, it's recommended to have warm-up because lack of warm-up or doing exercises too high percentages, exercises might provocate symptoms. Exercise should be done 6 to 12 weeks to see the benefits of the exercises concerning about the symptoms. If we think about current evidence about exercises, it should be relevant to start increasing everyday activity from small streams and think about exercise like investment for yourself in the long run. If you need tips for the increasing everyday activity or you have started to think about commuting biking from the other videos, you can easily see info about that. Hopefully this encourages physiotherapists to do the more manual examination and promote everyday activity in clients with the migraine. Hopefully you liked this video and see you at the next one.